Hi and welcome, and thank you for joining our diagnostics webinar series this afternoon. In today's session, Capturing Failed Follow-ups, What This Means for the Patient and the Practice, we will continue our discussion of the issue of failed follow-up as we explore the role of analytics in helping us to shine the light on and identify failed follow-ups, and further, how to make these insights actionable to ensure that patients are getting the recommended care that they need. Joining us today are Nuance Diagnostics Customer Success Executive, George McGuire, and Nuance Diagnostics Account Executive, Carrie Shockman. Before I turn it over, a bit of housekeeping. Please put all of your questions in the Q&A feature. We will address them at the end of the presentation. And if we don't get to your question, we will make sure to follow up with you after the webinar. We have all seen the headlines and articles highlighting the prevalence of the issue of failed follow-up. We're seeing increased lawsuits and malpractice settlements as a result of some failure to communicate the need for follow-up imaging. The impact of this issue is profound and widespread, but it is preventable. Last month, we had a session at SIM and spoke at this very topic. So for those of you that may have seen that presentation, some of what we share today may be familiar. But given the demand and interest in solving this issue, particularly in the light of the current challenges our healthcare systems are facing with COVID-19, the ebb and flow of patient volumes, identifying and prioritizing which patients need to get back for follow-up care, recovering revenue, we wanted to make sure that this information is available to all of our customers. And with that, I'm going to pass it over to George.
Hey everybody. So over the past 3 years, Nuance has partnered with approximately 120 practices to analyze quality and performance data with what we call a health check. Recently, we've been focusing on conducting in-depth analyses on follow-up recommendations, about 70 clients so far, and how many patients are actually returning to have those recommended follow-up procedures. On the current slide, you can see how we've isolated recommendations for MRI follow-up and CT follow-up specifically. The patients in blue are those who have returned for a study in the modality that was recommended, and then patients in green are those who have not. Clearly, there's a considerable opportunity for improvement. So we've aggregated the MR and CT recommendation data we've analyzed. For over 300,000 MRI follow-up recommendations, approximately 1/3 of patients are returning to have an MRI after a period of at least 6 months has elapsed. This means that 2/3 of these patients are not following up. For CT recommendations, the return rate is slightly better, with approximately half of the patients returning within at least 6 months and half not returning. Now, it's unreasonable to expect that all patients will return after receiving a follow-up recommendation. For instance, the radiologist may have had an incomplete patient history at the time of interpretation or didn't know the patient's risk factors. Perhaps the ordering physician was satisfied that the clinical question was answered, and it's also possible that the recommendation contained hedging terminology and was felt to be inappropriate or unnecessary. But even after accounting for these factors, we know that many of the patients that should return, unfortunately, do not. This fact has been highlighted by the success of the University of Rochester's follow-up management program, which achieved an overall follow-up compliance rate of 70.5%. So the University of Rochester published their findings from their follow-up backstop program. They showed an impressive improvement from 43 to 71% compliance. Estimated that the program would save 4 lives on an annual basis and could translate into significant cost savings in treatment through early diagnosis. In addition to the improvement of patient outcomes, the program did much more than pay for itself with a 4x ROI after considering the human resources and technology solutions which were used. It should also be noted that the use of NLP rather than just a manual follow-up management effort, yielded 3 times more volume to monitor. Now, PowerScribe Follow-Up Manager, which Carrie's going to walk us through in a moment, was specifically designed to address this important process. Using NLP technology, Follow-Up Manager automatically identifies follow-up recommendations based on the specific criteria developed by your practice, and it presents results in an easy-to-use work list. The application will automatically close outstanding follow-up exams when criteria are met and can facilitate communications by integrating with the EMR, PCP notifications, letter distributions, and gives the user visibility into outstanding scheduled orders. The platform also has robust reporting capabilities that allow you to track progress on follow-up management. So using the aggregated totals from the 70 clients we've evaluated, we calculated a plausible return on investment based on the University of Rochester's success. We determined how many more patients would need to return for both modalities to achieve a 70% return rate. We then multiplied the number of additional patients by the average national Medicare global reimbursement for each modality. So that's technical and professional components combined. Using this logic, we identified over $56 million in additional revenue, which can be achieved by the 70% return rate, which averaged out to approximately $800,000 per client annually. It should also be noted that this ROI projection may be conservative, as it only counts the initial exam each returning patient receives and does not factor in other subsequent evaluation or treatment. And also consider that private payers tend to pay more than the CMS rates. So follow-up adherence rates can also be significantly impacted by the appropriateness of the recommendations. Using our Empower Health Check analyses, we've observed significant variation by radiologists in both overall recommendation rates as well as the presence of hedging terminology. Excluding women's imaging and DEXA, which have built-in follow-up interval expectations, we found that approximately 6% of all radiology reports contain a follow-up recommendation. Approximately 1/3 of these recommendations contain hedging terms like correlate clinically or cannot exclude. PowerScribe 1 contains a clinical guidance module which assists the radiologists in making the most appropriate follow-up recommendations. I'm now going to turn the presentation over to Carrie to talk about that application.
Hello, everyone. So to follow up with what George was just speaking about, wanted to dig into the actual application a little bit more and how it actually works. So next slide. So first and foremost, because we're using NLP to pick up these recommended follow-up exams, the radiologist will continue to do what they're doing today and dictate the report as they would normally do. They will have recommendations identified for follow-up, and then using the Nuance AI through the NLP engine, we will pick up and populate the follow-up manager solution with all of the various recommendations. From there, a navigator staff can track all of the exams, reports, communication to the patient and or the providers to get to the end result of making sure that this patient comes back for their recommended follow-up exam, or that they've documented why that patient didn't come back for some of the reasons George mentioned previously. The solution can also take some particular findings and allow you to track them to their diagnostic outcomes. So the solution is often used specifically for lung nodules that may be outside of a lung cancer screening program to actually track the steps that we get to a positive diagnosis for cancer from a lung nodule, or the continued screening of those nodules. And then finally, the solution has a comprehensive set of analytics and reporting, so you can measure your volumes, outcome, quality, and even your ROI data from where you started with your percentage of patients coming back for the recommended follow-up exam to hopefully 70% or above. I think it's important too to mention that we just use two modalities in these evaluations, CT and MRI, but of course there are recommended follow-up ultrasounds and other diagnostic exams, and sometimes multiple exams, as George mentioned. Go ahead and go to the next slide. So the first step in this process, obviously, is identifying statements using NLP to go ahead and populate the tracking board with these follow-up recommendations. Typically, we will, our customers will start with removing hedge statements, and I'm going to talk about that a little more in statements. So certain types of follow-up exams that have a specific modality, a specific time frame for the recommended outcome. That's why this gels so nicely with clinical guidance that can be incorporated automatically into the reporting. So first, we're picking these up automatically from the body and the impressions of the reports and populating these tracking boards. Go ahead and go to next slide. And the design of the follow-up manager from a workflow is all workflow-oriented filtering. So as your navigators will work on this, we'll look at overdue items needing attention. This is fully integrated and getting all the information from your information systems, your EMR, RIS, to get patient-level information, order information, et cetera. So the navigators can focus on, the overdue items. You can also filter this by location or facility, by type of findings. So in some organizations, the lung nodule follow-up recommendations might go to pulmonary. In other instances, radiology is managing all of these initial closing the loop for follow-up recommendations. So set up to be easy to use and also easy to distribute the work among multiple departments as needed. Next slide. So this is just an example of a tracking board for overdue exams and overdue communications that you may be wanting to work through through the solution. So making it easy for these navigators to track where it's been. So on the next slide, just to kind of go back a second, one of the things that we do is we are going to automate the exams and to close them for all of those exams that had a recommended follow-up that actually came in for the recommended follow-up exam in the time period that was recommended. So we have a lot of flexibility here. As you saw in the statistics, we're seeing about 30 to 50% compliance across MRI CT over these 70 customers that we've done this analysis on. And we give you the flexibility to say to which ones do we want to auto close? Are there other ones that we actually want to review before we auto close? But the idea is to really hone down the work that the navigators need to do based on those patients that are still unknown for coming in for their follow-up exam, haven't been shown that they've been scheduled or completed. So as we have some flexibility in how we close those. So when we look at those tracking boards, it will only show those exams that are needing additional follow-up. Go ahead and go to the next slide. Each organization will have individual workflows on the steps that they'll take to track patients down. And so this may be some combination of phone calls to PCPs or the ordering physician, to direct notification to patients. So we include do-it-yourself letter template management with all of the mail merge capabilities within that. We have the ability to document, and we show you all of the PCP ordering physician information, patient information. So if phone calls need to be made, that's easily available. And being able to design your workflows to be flexible based on whatever communication protocol you have. And then there's a number of options for integrating right into your EMR. So on the next slide, we talk a little bit about, and there are various methods based on the individual customer's preferences and or capabilities with that third party. So we may be extending information that we have to the problem list, to discharge instructions, to inbox messages, being able to put the letters that are generated here in a shared letter repository, and integration to patient portals. So as we get into getting organizations set up with our follow-up manager solution, we'll work to see what kind of integration is needed and required for our customers. We want to be able to track, the reason that we're not going to get to 100%, and we don't expect that any customer is going to get 100% of their patients are going to have all of the recommended follow-up imaging that the radiologist may say for a variety of reasons, as I think George really outlined some of those earlier. But it's also important to close the loop and to document why there was non-compliance. So it could have been the physician's choice, as in this example, that they were a palliative care patient and therefore this particular follow-up exam was unnecessary. You can track things as a closure reason of, that they actually had that imaging done at another location, or they had a different imaging study done that satisfied the requirement. So this way, from a tracking and compliance perspective, the goal would be to always have a reason that they either came back and you made sure that that patient came back, and or you've documented why they didn't have that exam done. Okay. And then lastly, it's important when you're implementing a quality-based program like this to really improve your outcomes, is you want to be able to easily report on that. And so we provide some reporting capabilities that you can track things like subsequent exams following a recommendation, what were the exams that were a result of the tracking interventions, and in the case of some findings, what were the diagnostic testing following the recommendations? So that's all important things. So in closing, and we're a little ahead of schedule, which is unusual, but we'll have a little bit of time for additional questions, or I can dive into some other things in more detail too. But obviously what we're looking to do from a benefit standpoint in summary is supporting improved patient outcomes, gain visibility into program performance, facilitate patient follow-up. Even when we do a great job of notifying the primary care physician, or even notifying the patient at the beginning when the incidental finding was reported, there's still a lot of opportunities for that patient to not actually come in for that was recommended. So really closing that loop and ensuring that from a patient care perspective, the patient just isn't getting something done that they should be getting done. This, of course, reduces potential liability and improves the financial outcomes of organizations. To see an average across all of these customers that were varying size, to see those significant of ROI numbers really more than covers, and it's a positive ROI for the cost of implementing these solutions. So I think that was my last slide. So we actually are, I think George and I both spoke faster than we were intending, but we're happy to field any questions through the Q&A.
Hi, we actually do have one. Sorry, there's a little bit of technical issues. Can you hear me okay?
Yes.
Okay, so it says, how are customers starting these initiatives? Do they start with all types of findings and recommendations? Is there a best practice?
Okay, I can take this. I think so. The early days of this application was ours expanding upon our lung cancer screening module, which is built specifically to accommodate all of the requirements of the ACR and the CMS for documenting things within the registry for lung cancer screening. As part of that, we were tracking the nodules for within that patient population and expanded and developed Follow-Up Manager really first for tracking the other lung nodules for the patients outside of that patient population. For those of you who know about lung cancer screening, there's age requirements, smoking requirements, et cetera, to be part of the lung screening population. So initially, the Follow-Up Manager was used for lung nodule screening. And so that's sometimes a place where organizations want to focus first, is on certain kinds of follow-up recommendations that have clear, consistent follow-up recommendations, and then branching out from there. But really, you can dial into however broad or granular of follow-up recommendations that you want to track. Hopefully that answered your question. So we'll see that other kinds of adrenal, thyroid nodules sometimes are places people start.
Thank you. And I see that there is one more question. If George, this one is directed towards you. Okay. If you could just explain a bit more about what the NLP is doing to extract these recommendations.
So I think Carrie and I could probably both speak on that. So essentially the NLP is the logic that's used within the application to actually identify the presence of a follow-up recommendation, as well as whatever other criteria you've defined. So if you're looking for certain types of procedures or certain follow-up intervals, if you're only looking for missed follow-ups, or perhaps you wish to exclude follow-up recommendations that may have hedging verbiage that's identified. So there's a lot of complex logic that can be applied within the application to give you the tailored results you're looking for. Carrie, did you want to add anything there?
Yeah, no. So they're within the system, and there's the ability to create these polling events against the NLP. So you have a lot of control, and most folks will start with, and I think George, you had a slide that talked about this, was, clearly identified findings. So a specific modality, time frame, recommendation, avoid any hedging language. Let's start with, the finite group, and then grow out from there. One of the other things that I didn't talk about, but that some of our customers in Pennsylvania are using Follow-Up Manager for, was to accommodate the PA Act 112 rule that required radiology departments to notify patients directly through a letter or other means when there was a significant finding that they would need to take action within 3 months. So we were able to specifically align this tool to meet the needs of that requirement. We believe other states will have similar laws put in place. So this is just another niche area where we use Follow-Up Manager to fulfill the requirements of that act, where we're having them generate auto letters to send out, and then those patients will go into the follow-up queue to be able to make sure that they actually come back for that recommended follow-up exam.
Perfect, thank you.
Any additional questions? I'm not seeing any on my Q&A module.
And from my end, there aren't any as well. So I think it is safe to say we can wrap up.
All right, well, thanks everybody for attending. And if there are additional questions, we can certainly answer them offline at a later time.
Okay. Yes.
Thank you.
Thanks a lot.
Okay, thank you everyone. Bye.
Have a good day, bye.